Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Sharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. We are still in the middle of the stay-at-home edict that in Los Angeles that we hope is going to be lifted soon. So, it's a different time and a different world than what we're used to. I'm sure as part of your practice, you must be seeing this, but I have friends, acquaintances, people who are in the professional side of it who are seeing a huge spike in people who need help because their eating disorders are being triggered from the current situation that they're in. I mean, have you seen anything like that in your practice?
I mean, the truth is, in the clinic that I work in, we have a couple of kids with eating disorders, not so many, and they were actually further along in treatment, so They seem to be doing okay. Although this is by phone check-in, and they seem to be handling things fine. But I could see where it can trigger symptoms for people and trigger a lot of anxiety. Mm-hmm. Also, because a lot of people with eating disorders get into very set routines for themselves, and some of these routines they can't be in anymore. Right.
Yeah, I would say that could definitely be a problem. So we're actually lucky today that we have Robyn Goldberg joining us today to help if anybody out there is being triggered with their eating disorder, or they know someone who is. Robyn's going to provide us with some guidance about, next steps, how to handle this, what to do. Robyn began her career at Cedars-Sinai Medical Center in Los Angeles as the inpatient dietitian in the Department of Cardiology. Over the last 23 years, she has developed her own private practice in Beverly Hills, California, where she specializes in medical conditions, disordered eating, eating disorders, health at every size, pre-pregnancy nutrition, and people in recovery. Robyn is a certified eating disorder registered dietitian and the author of the new book, The Eating Disorder Trap, A Guide for Clinicians and Loved Ones. Hi, Robyn.
Hi.
Hi, Robyn.
Hi, both of you. Thank you so much for having me today.
Yeah, it's our pleasure. I mean, I'm sure your practice has seen a lot of changes over the past 2 months now, I guess, 6 weeks to 2 months. What have you noticed?
Well, I've been virtual for the last 8 weeks, and kind of as Andrea was referencing, I think many people are really triggered, activated through this time because oftentimes individuals used to, quote unquote, controlling what they will eat, when they will eat, and there's so much uncertainty now that's really heightened the anxiety and distress amongst many, in addition to those that compulsively exercise and really engaging in self-destructive behaviors. So yes, I mean, I've had clients increase sessions. I've had clients definitely be open to virtual meal companion support. But I think it's really been a coping mechanism that individuals have engaged in, since it could be all ages, all genders, all body shapes, sizes, all religions. I mean, no one's immune to developing an eating disorder.
And even before this all happened, the prevalence of eating disorders has significantly increased. At least the diagnosis of eating disorders has been going up consistently, correct?
Correct. I mean, about 30 million Americans of all ages and genders actually suffer from eating disorders, and these numbers are constantly growing. And it's really, there's been a 18% increase actually from 1999 to 2001. So it's definitely on the rise. And I would imagine even post quarantine and pandemic, eating disorder statistics will continue to be increasing because there's been many, many people that struggle with eating disorders and they quote unquote could look normal. They don't have to live in a smaller body. They could appear normal or live in a larger body. And they've not been taken seriously by other healthcare providers, friends, family, and such.
Right. And the medical field itself has not necessarily kept up with the growth of eating disorder in terms of people who are really trained to help them and identify who could help them best and what they need in their treatment.
Yeah, I mean, it's really a shortcoming in the field. In fact, this morning I had done a Facebook Live, and one of the things I was discussing is I think people like Andrew were describing that it's oftentimes younger individuals, but actually empty nesters, the Medicare population, is the largest growing population to have eating disorders. And so last April, actually, I lobbied on Capitol Hill with the Eating Disorder Coalition to be able to protect, actually, there's one, in the Affordable Cares Act, they actually reimburse empty nesters who have diabetes, renal insufficiency. There's 4 pillars, and 3 out of the 4 they actually cover, and not recognizing that an individual who is a Medicare patient is actually the largest growing to have an eating disorder. So I had received this email yesterday from Senator Feinstein's office because I actually met with her staff as well as some other individuals that are part of California. And they said that she's about to sign the bill. And if I could just send one more paragraph. So I was like, that's awesome. I mean, it's taken a year, but these are the changes that we really need so everybody can be helped.
Congratulations. That is very, very good news. Because eating disorders, like you said, in the senior population, I think just in general, eating disorders are difficult to treat and diagnose. And I can imagine people aren't necessarily looking for it in the senior population. Yeah. So it's probably even harder for a clinician to identify it and really figure out what's going on.
Especially if they don't know appropriate screening questions to ask as well.
Right.
Yeah. Robyn, could you talk a little bit, maybe since we're on the topic, about how eating disorders might present in the older population? Because I think we're used to how it presents, a little bit more used to, and all the coverage, media coverage, a lot of it is how it presents in teens and young adults.
Good question, Andrea. So oftentimes there's been some sort of trauma that has occurred in one's life, maybe the death of a spouse, a child going off to college, or their child going through a divorce, or they have gone through a divorce. And maybe, this person struggled with food and body image earlier on in life, but it takes something really to set them off where they're recognizing they're restricting, they're compulsively exercising. And like I have a client now, and she actually had a fracture in her foot and in her hip. And unfortunately, I don't think her doctor is doing due diligence to have her stay up to par with bone densities, and ended up that, she's osteoporotic like everywhere. And then she started to, share more what had been going on personally in her life. And I think as you probably, find this, Andrew, it's like, physicians are very busy. They, unless they're a concierge physician, they're usually not getting into every detail in their life in regards to what has transpired. And in fact, this client does not look sick, does not look emaciated. And it was a true wake-up call to her doctor and now the rheumatologist that she's seeing too.
So I know Andrea and I have done an episode, it was episode 37, where we spoke about eating disorders in the Orthodox Jewish community, where we kind of went through, and maybe we could do it again briefly. Most people think of anorexia. When you say eating disorder, they think of anorexia, but eating disorders actually covers a range of disordered eating patterns. So maybe you could just talk briefly about what those are.
Sure. So actually the most common eating disorder that's the most overlooked is binge eating disorder.
Mm-hmm.
And 60% of women struggle with it and 40% of men struggle with it.
Wow.
So it's very, very high, actually. And like Jill was saying, I think most people associate eating disorders as anorexia nervosa and bulimia nervosa. Binge eating disorder is not taken seriously, and it's a true diagnosis. Unfortunately, now it is in the DSM. But, there's so many other, I'm going to say, like, subsets. And if a person does not have a full-blown eating disorder, and perhaps you both know many people like this, they actually have orthorexia nervosa. And what that is the obsession to eat healthy. It has to be organic. It has to be raw. It has to be vegan. Like all these rules where they take health to a level that is taking the pleasure away from eating. And oftentimes, whether it's a loved one, will say like, oh yeah, it's great. My spouse is trying to eat healthier, or my child. But then it gets to a place where it's like, I remember before quarantine, I was sitting with this child and the mother came in, and the child had asked the mom, like, oh, do you have any grapes in your purse? And mom's like, no, I didn't buy them. They weren't organic this week. And was like, I only bought the organic. And it was like, okay, the boy was asking for some grapes. So it's taking health to an unforeseeable level where the obsession is just through the roof, essentially.
Yeah, it's and people really overlook it because they're like, oh, that person's eating so healthfully, and look at that, and go them, and it really is just another form of disordered eating. You have a chapter in your new book, The Eating Disorder Trap, where you talk about what is normal. When we say, what's a normal eating, it's different for everyone, right?
Definitely. Some people, what's normal is they eat 2 large meals a day. That's what they've always done. Others, snack multiple times a day. Others have, 3 meals and they don't snack. But I think it's really learning how to be an expert of your body and know what makes you feel strong, clear, focused without all this confusion that is centered around through diet culture.
It's really hard though. We are constantly bombarded with all this information. And right now I was just seeing pictures of the singer Adele that were posted. She just lost 100 pounds, and the internet just totally blew up with, why are we focusing on her weight, or good for her? Doesn't she look great? It becomes this touchstone of our conversation. All about weight loss, and it's fascinating how much time and energy it really takes up in our daily life.
And I think too, actually, Jill, on that topic, yesterday I was looking at one of the closed social media groups that I'm a part of with all non-diet approach, health at every size clinicians, and like one of my colleagues had written, it's like, who cares what her body shape and size is? Like, this is a woman who was, going through a traumatic, termination of a relationship, had a child. And so I gave a presentation a couple years ago on binge eating disorder with a colleague of mine who's very well known in the binge eating disorder arena. And so in the 4-hour talk that I gave, one of the sections was on Hollywood and binge eating disorder. And one of the examples I had given actually was Adele, and a great clip that was on 60 Minutes on, she pretty much like didn't care what people thought of her, and she was not going to have her food choice shift as a result of it. And I think as this, is now has exploded on social media, I feel like she's sort of a sellout to her core values, because I think she's someone who just genetically lives in a larger body. And if you're having to go through unnatural extreme measures to be in a body that your body is just not naturally meant to be, that certainly could do more harm than good.
Yes. And she actually was drastically cutting calories. She was eating, I was looking today, she was eating about 1,000 calories a day in the beginning of the diet. So maybe now is a good segue to talk about how this deprivation, the malnutrition, when people have eating disorders, what the effect is the physical effect is on the body that people are not even aware of when they're starting to really restrict or binge, or the havoc it wreaks.
Well, there's many parts. Well, I should say all body parts are impacted. Nothing is spared. But an individual may not think, for example, if they have sleeping difficulties. I hear this all the time. They'll ask their internist because they don't want to go to a psychiatrist for a sleeping medication, when in fact, if a starved mind is a starved body. And if you're not consuming enough fuel, your sleep patterns will be compromised, as well as your thought patterns too. So if you're in a conversation, then you're losing thought of what you were speaking about, or being able, we all lose hair daily, whether, we're combing it or on our pillow or in the shower. But when individuals having chunks of hair falling out and their thyroid is normal, or they're always putting moisturizer on and they're finding that their skin is dry and that their nails are breaking, or they have bruises and wounds that will not heal. I mean, I can go on and on. That's like a whole
right.
show within itself.
Right. It does. And it's hard to come back from that. I'm guessing it takes time to get the body back to a point where it's operating at a healthy level.
I mean, I think it depends how long the person has had their eating disorder. So you say it's hard. I mean, everything's hard, but it does take years, especially if you've been engaging in self-destructive behavior for years, because eventually your body starts to fall apart.
Right. So you wrote the book, The Eating Disorder Trap, because you felt that there was a gap in help for people out there, either somebody who needs to treat someone with eating disorders who may not be necessarily specifically educated in that field, or for somebody who knows someone, could be a loved one, that is suffering from an eating disorder. And you tell a story in the book called The Helicopter Story. And I was wondering if you'd share that with our audience, because I think it really, it was something I was not aware of.
Yeah. I mean, I think like the best way to describe it is when an individual has an eating disorder, they think everyone is lying. They're not there to support them because their eating disorder voice. So we like to use the term ED or Edwina or ED, and that stands for, ED as eating disorder. And the eating disorder has become a companion, a friend. Really, like if a person has an eating disorder, it's not possible to have another relationship in their life, because the eating disorder voice has sucked you into the web of lies, and everything a person hears in their head is what they believe. So, based with the helicopter story, it's like, I have many versions of this, but my colleague who is an expert contributor in the book had used this from the Rife and Rife book, which is a very well-known eating disorder book. And essentially, when you're at a place that you've hit your bottom and requiring help, the way it's described is like, I might be confusing another story than another, but essentially, say you were on a cruise, okay, and the boat said, like, you know what, I have to jump over, grab the life preserve and go in the ocean, and the helicopter will be sweeping up. It's like, really? Like, I don't see a problem. But you know what, like the fire alarms are going off, there's a problem, and basically like not believing what is happening. So, I mean, we see this time and time again where an individual is getting deeper and deeper in this hole, and now they're in the ocean, and the helicopter's saying, okay, you know what? You have your life preserve on, and you're, hanging on to this piece of wood in the water. Let go of this piece of wood, and we're going to throw a cable down into the ocean for you to grab so we can pull you out. It's like, I don't know if they're going to do that. I don't know if I trust them. Well, this is the same thing when an individual is pretty deep and they're struggling and they don't know who to trust. And it's like the leap of faith. You know what? I'm just going to let go of that log and just hope for the best. And it's really because a person has lost all confidence of themselves, and also what's called their soul self, the healthy self, like our core values that we're born with. So essentially, like what you were asking, Jill, so the helicopter story is just like you've surrendered, and, I'm going to listen to, the treatment team that I'm a part of, and hopefully an individual has a team, because having a team, which includes an eating disorder trained registered dietitian, eating disorder trained mental health provider, eating disorder trained internist or pediatrician and or psychiatrist, is really the most effective way to work towards a place of recovery and have this comprehensive team.
Right. So it's a big ask to have somebody let go, I'm sure, of this life preserver, which is standing in for the eating disorder, to ask them to let go of that. And especially if it's been a long time, is a big ask from someone. So
yeah.
Go ahead, Andrea.
Yeah. I think one thing I really liked in your book, there are a lot of things I liked in your book, but one thing I really liked is when you start to talk about how it's about the food, but it's really not about the food. It's about whatever other struggle the person has been dealing with. I think for a lot of people, it's a sense of lack of self-confidence, or, from traumas, from other things that have happened in their life. And the food has been like something that they can control, something that they can feel on top of at a certain point, even though they start to not be on top of it, as we know. And I think it's hard because it's so obvious in some ways that about food and eating and, regulating that, it's much harder to deal with, lack of self-esteem or lack of self-confidence or other things that have happened.
Well, and also too, like you mentioned, yes, thank you, Andrea. I mean, now people are hanging on to, for dear life, what they can control. Because we can't control when there's a vaccine. We can't control if the fruit we want is available at the store. We can't control if we're going to be laid off or not. Like, there's all these things that are uncertain. And the eating disorder has provided that sense of something I can control and regulate in my life.
Right. So what somebody who is suffering or watching somebody suffering, what would be the first step you would tell this, let's say someone knows someone, to help them? What would be the first thing that you would tell them to do?
Well, I would definitely get resources to help them with, like NEDA, N-E-D-A, the National Eating Disorder Association, because if they did not have a physician or know where to turn, NEDA would be where I would suggest to start, as well as IADEP, IAEDP, which is the International Association of Eating Disorder Professionals. We have chapters all over the world, actually. All the eating disorder trained physicians, registered dietitians, nurses, actually, mental health providers, therapists, psychologists, marriage and family therapists, social workers. And also, I would say to be able to go to what's called IFED, IFEDD, which is the International Federation of Eating Disorder Dietitians. I am the Los Angeles ambassador for IFED. And prior to quarantine, for the last bunch of years, I will do on-site visits of the best treatment centers all over the United States. And then we have actually 3 dinners a year, actually, with whichever treatment center. Many of them will fly out here, and it's all the eating disorder trained registered dietitians in Los Angeles. And the treatment center, would typically talk about like what they're doing that's different in their program now, but now I've made it more educational. Well, they'll do some sort of PowerPoint presentation, but it's been great to be able to keep people up, current with what all these different treatment centers are doing.
Okay, great. Any other tips that you want to leave our audience with?
Yes.
Yeah.
Okay. Tips. Use the resources. So it doesn't matter your age. You can always get help, and it's never too late to get help. So I want to emphasize that. It doesn't matter if you're 65 or you're 25 or you're 85, that it doesn't matter your age. You can always get help and support. Also, having the courage to reach out, not feeling like, okay, you know what, people, my community is, everyone talks. It's like, even just, using like the Orthodox community, I have many, many clients, and it's like prevalent. And to say, you know what, you're human. It exists everywhere. So I wanted to say that too, to not feel shame and judgment, and to know that there is help available. And other than from a religious standpoint, the food rules, really looking at how to drop food rules that one has in their life. And I know, like, I was having a conversation with a client the other day, and he was telling me he had a conversation with his rabbi, and how, he's having a hard time working in this particular food. And anyways, he was asking the rabbi, like, is it okay if, because I know even just when like Passover was happening, he's like, I really don't feel safe eating such and such. And the rabbi's like, don't eat it. Do what works for you. So I think that's important to hang on to, because I know within the community, there are so many rules, and they're not all definitely, religious related. And I think oftentimes it's been heightened. And I hear from clients that they feel like, Robyn, you know what? I have such a hard time going, for dinner Friday night and then Shabbos lunch. And I feel like there's always food, and how to actually work around that. So I wanted to say, like, really trying to work on how to eliminate rules that are diet culture related.
I'm so glad you brought that up, because that was going to be my last question for you, because I know you do deal with people who are in the Orthodox community. And I wanted to know, like, what's different. And you brought up the idea of there's still such shame and such a stigma around any mental health issues, particularly with eating disorders. And in terms of relaxing the rules, it was really interesting during this last Passover and this time period, how many rules the rabbis were willing to relax. I mean, in Israel, the Sephardic rabbis allowed a Zoom Seder, if you were Orthodox. Like, now, during this period where we have between Passover and Shavuot, we generally don't listen to music. But a lot of the rabbis have said, you know what? It's okay to listen to music if mentally that's going to be good for you. So things that we could have never imagined a year ago, these rules have changed. So we have to remember, like you said, that the rabbis will make accommodations and will allow you to break some of the rules if one's mental health is at stake. So, yeah.
And the other thing I want to say is, like, I can think of 2 clients over Yom Kippur that actually spoke with their rabbis. And one of them actually was, newly diagnosed with diabetes. And her rabbi, because she was like, Robyn, do you think I could fast? I was like, no. And she's taking insulin, the whole thing. And her rabbi was wonderful. He was like, your health is number one. He's like, whatever the dietitian says. And I was like, I'm happy to speak with him if you would like. And then the other client, actually, who, had been struggling and still, of course, with anorexia nervosa, she was like, oh, can I fast? And I was like, I think that's just kind of getting you back into that place. And she's like, yeah, my parents don't think it's a good idea either. I was like, I don't. And I gave all the reasons. And her rabbi, another rabbi who was fantastic, he was like, no, like, you've been in treatment, several times. And so I think, like, the rabbis that I've encountered have been really supportive and wonderful with the clients. And I think it's just being honest and owning your story, and to be able to speak your truth to them. And I think, hopefully they'll all be flexible.
I think a lot of times some of the inflexibility is more from people than from their rabbis. Because most rabbis actually, and it's not about breaking rules, it's about understanding how to apply the rules appropriately. So my husband has a number of medical problems, and he's had post-transplant years ago for a kidney, and he hasn't fasted in years. And when he originally went, talked to the rabbi about it, the rabbi said, listen, for you, it would be, well, it's sinful, but it would be breaking the law to fast during Yom Kippur, or to observe any of the fasts. You are not permitted to fast, actually.
It's actually against the rules.
It's against the rules, right? It's against the rules for him to fast.
Yeah, it's interesting, Andrew. I agree. I mean, I think the clients are oftentimes harder on themselves than the rabbis. Yeah, good point. Thanks for bringing that up.
Yeah. So thank you, Robyn. This was really great. I think it will be very helpful for people who are listening to this, just to even be aware how prevalent eating disorders, disordered eating is, and that there is a way to get help. I know Andrea said she would totally recommend your book to others in the field. And it was also, I would say, for people who are not in a therapist or clinician, for me, it was a very easy read, which is good. So it's not a big textbook jargon, scary, medical tome. It was very accessible to read. So Andrew and I both highly recommend anybody who wants to learn more about this to go get the Eating Disorder Trap, Robyn's new book. You can go to the eatingdisordertrap.com. Robyn's website is askaboutfood.com. She's on Instagram at Robyn Goldberg RDN. She's
Robyn with a Y.
Robyn with a Y, right. I'll put all this on the website. I'll put links on the website. She's also on Twitter, also Facebook. So if you want to reach out to Robyn or buy her book, I will put links there for you to be able to do that. You can also follow me on Instagram at Jill Scharfman. I want to thank our engineer, Mike Casantini at the Network Studios. And yeah, Robyn, great. Lots of good information. And I hope your book tour resumes very soon in the future. So that, so we can come celebrate it with you.
Yes, please.
Yeah.
Thank you so much, both of you. I really appreciated you having me today and your time.
Yeah, no problem. Thank you.
Thank you.
And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004. Post on Instagram, Twitter, or Facebook with the hashtag #LetMyPeopleEatPodcast. If you like this show, please make sure to leave us a 5-star rating and review on iTunes. Tell your friends and family, and subscribe to us on Apple Podcasts.
And please remember that although we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own health practitioner about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I'm Andrea Moskowitz.
Thanks for joining us.
And go in good health.